Doctor, good to see you again.
Good morning. You too.
This is a new year, and
Yes.
when we're all out getting our health checkups for the new year, it's also probably a good idea to do it for our pets as well.
Absolutely. You want to do that yearly check, if for nothing else to get vaccinations, but also just to make sure teeth are healthy, the skin coat looks good, the eyes. Definitely want to do it at least once a year.
And today you want to talk about feline lower urinary tract disease. What is that?
Yes, it's actually probably the most common disease that cats face because, they have such a stressful life. However,
to be a cat.
Yeah, and also sometimes diet can play a role in these sorts of things. A lot of people feed them all different types of diets, and that's one of the reasons why they are predisposed to getting lower urinary tract disease. But it could have several factors. As I said, diet, it could be just the anatomic configuration of a male cat versus a female. They could have scar tissue, little tissue plugs. So there are quite a few things that can contribute to that.
So who's more predisposed to it? Male cats, female cats, kittens, older cats?
Male cats, and actually we do see it more with the younger cats in terms of an infection. But the male cats in particular, they have a very narrow urethra and it's very long. So they are more predisposed than female cats.
So as a cat owner, or actually one who is owned by a cat,
Exactly.
what should we be looking out for?
Well, the first sign that we see is they're straining in the box. They're in the box for quite a long time. Sometimes nothing comes out. Occasionally blood can come out. It's definitely possible. Meowing super loud in the litter box. Also just frequent trips to the litter box. Those are probably the most common signs that we see.
And that's probably a good point to bring up too. When we're cleaning out the litter box, we're probably just cleaning it, but there are signs there and clues to our cat's health.
Right, absolutely. And it also could be with fecal health as well. But with cats, they very often will have just spotty urine, even leading up to the litter box. And also urinating inappropriately, so maybe it's on your bed as opposed to in the litter box because they're so well trained. So that would be something you'd want to look out for. And in terms of if they get an infection, that's, really great. You could take them to the vet, tell them the symptoms, they check the urine sample, and many times they'll put them on antibiotics and see how they do in about a week. However, if they don't respond, then we get more aggressive in terms of, taking x-rays, especially in a male cat. We're particularly concerned because they can completely block and be unable to urinate, and that is actually an emergency.
Oh, so how potentially dangerous, aside from this emergency situation, is this for the cat? Are they in a lot of pain?
Very painful. As a matter of fact, they are meowing constantly. And also just the fact that there are little particles sometimes in the urine, and that's really irritating, to their urethra. So it is something that if you see any of those signs, you want to take them, as soon as you can to the vet.
And you talk about blockage. Can they get like kidney stones, bladder stones, something like that from this as well?
Yes, so, and that's another thing. With male cats in particular, they can have a block because if any crystals accumulate in their little urethra, it makes them unable to urinate. In that case, it's an emergency and the vet can unblock them. You definitely want to get them in relatively quickly for that. And it can be as a result of just blockage from crystals. However, it could also be related to stones in the bladder. So that would be something an x-ray would definitely definitively tell you.
Hello, my HMTV viewers. I'm here to inform you that Dr. Danielle Spencer, beloved for her role as Dee Thomas on the 1970s sitcom What's Happening, has died at the age of 60 years old. Born June 24th, 1965. In New Jersey and raised in the Bronx, Spencer became a household name at just 11 years old, with her quick wit and iconic catchphrases. She reprised her role in What's Happening Now during the mid-1980s, cementing her place in TV history. In 1977, Spencer's life was forever changed by a devastating car accident that killed her stepfather and left her in a coma for 3 weeks. Despite this trauma, she returned to acting before eventually shifting her focus to academics and a new calling. She earned her Doctor of Veterinary Medicine degree from Tuskegee University in 1993 and built a second career as a respected veterinarian in Richmond, Virginia. Known for her compassion toward animals, Spencer also advocated for animal rights and occasionally appeared on television to share pet care advice. Spencer battled significant health challenges over the years, including spinal stenosis, breast cancer, and complications from her earlier accident. In 2014, she was honored as the first former child actor inducted into the Smithsonian's National Museum of African American History and Culture. She passed away on August 11, 2025, after a battle with cancer. Remembered by co-stars, friends and fans as a brilliant, loving, pragmatic warrior, Spencer leaves behind a legacy of resilience, talent and service. She is survived by her mother, Cheryl Pelt, and brother jazz musician Jeremy Pelt.